Research article critique presentation. Management and relief of pain in the emergency department from the adult patient's perspective. Nurse 443, Evidence-Based Nursing Research and Practice. Instructor Linda Hansen-Kyle, PhD, RN, CCM. Kim Mills-Garcia, RN. University of Phoenix course that discuss the importance of research article critique and presents the need for evidence-based research in nursing practice. I am a student that researched this article, Management and Relief of Pain in the Emergency Department, from the adult perspective. Volume 25, number 6, June 2003, Journal of Pain and Symptom Management. This was conducted in Paris, France. Therefore, the doctors and nurses involved in the research, all of their names are difficult for me to enunciate, therefore I'm going to bypass them. Next slide. Overview of the study. The purpose for this study was to estimate the prevalence of pain in the adult patients visiting the ED of a Paris University hospital, and to identify risk markers for insufficient pain relief. The university hospital in Paris had a great concept to assess the patients at the beginning of their emergency room visit. They wanted to measure a before and after pain management assessment to ensure that their pain was addressed and managed. The consents were obtained in the beginning and the participants were protected for their safety and welfare. Next slide. The meaning of qualitative research study. Qualitative research aims to get a better understanding through first-hand experience, truthful reporting, quotations of actual conversations. It aims to understand how the participants derive meaning from their surroundings and how their meaning influences their behavior. This article proves that patients in the emergency departments are not getting proper pain management. This is also a concern in the United States as well. We are focused on disease and pathways to prevent further damage to the body. We forget that patients need to feel comfortable, and having pain addressed is equally important to them. The outcomes for patient satisfaction is an area of concern with hospitals nationally. This qualitative research aims at addressing the need to improve pain management in the emergency department. Strengths and weaknesses of the study. Weaknesses. A cross-section survey was conducted for 16 days, 24 hours each day in the ED of a Paris University, France. Strengths was on the arrival, 78% of patients complained of pain. Among them, 54% complained of intense pain. 47 suffered procedural pain. Insufficient pain relief was assessed at 77%. Of the 810 eligible patients included in the survey, 726, that's 90%, completed the questionnaire. Age, sex, and time of arrival did not differ between patients who completed the questionnaire and those who refused. Of those who completed the questionnaire, 50% were males and the median age was 37. The range was from 18 years old to 97. The length of the case study may have been short in time, but 90% is a high number of respondents for pain management data collection. This provided strength in a short study period. Methods. Study design cross-sectional survey was conducted in the ED of Paris University Hospital. Data was collected during 16 days from 14 to 19 of October of 99, 24 hours each day. Anonymous data was obtained from patients by 46 trained interviewers using a structured questionnaire. Pain intensity was self-evaluated. Only patients aged 18 and over were eligible to answer questions. Each patient was usually interviewed 3 times: on arrival, after medical examination, and before discharge. Some of the interviews were not obtained in the urgency of their medical emergency because it came after medical examination before discharge were conducted. This privacy was obtained if too many patients were in the area. The interviewer would wait, missing the arrival of the appropriate interview. Ethical and legal considerations. In France, a medical examination is required before going into police custody. This is traditionally performed in the ED and explains the high proportion of 8% of prisoners and ED under arrest attending the ED. Prisoners and patients under the arrest were excluded from the study, as consent is required in French law to participate in a clinical study, and we did not consider these patients were free to give their consent. All other participants were of age and their consents were obtained for this article research. Relationship between theory, practice, and research. Pain is connected to comfort, which is a nursing diagnosis, alteration in comfort. Comfort of a patient is important to nurses. The focus to decrease discomfort is a top priority in nursing care plans. Of the 563 patients who complained of pain on arrival, 362 patients assessed their pain on both scales. These two scales were found to correlate. 384 patients underwent pain intensity evaluation both at the first interview and prior to discharge. In these patients, insufficient pain relief was assessed at 77% of cases. When the patient is complaining of pain, and the nurse should be addressing this with the patient and physician. The relationship between the theory, practice, and research are closely related in discussing pain and management of their pain. Nurses' role in implementing and disseminating research findings of the article. The nurse is an advocate to voicing pain needs. The nurse is responsible for communicating evidence-based practice to meet the standards of patient care. This article shows nursing need for improvement in pain management. We found that patients with moderate to low pain were relieved less than often, were even less than received interventions before or during an examination than patients with intense pain. Moreover, moderate or low pain was independently associated with insufficient pain relief on discharge. This article shows concerns with patients leaving the ED with significantly high levels of pain. This is an area that needs quality improvement of patients' comfort needs. How the research study provides evidence for evidence-based practice or outcome practice changes. Studies have reported that only patients with severe pain received analgesics. Untreated patients had a low level of pain on admission. The severity of pain correlates with pain management practices. Patients with mild to moderate pain were unlikely to receive pain medication. This article shows the readers how much pain is not addressed for mild to moderate pain levels in their emergency room visits. Some changes in everyday practice are required to improve management of moderate and mild pain. And care providers should be trained to consider pain of moderate or mild intensity and to integrate pain and its relief into the assessment at the emergency level. According to the article, early analgesic administration before medical examination should be investigated in terms of safety and efficiency. In France, nurses are not legally authorized to prescribe medications unless there is a protocol that specifically determines the details of analgesic administration. even though they're training well suited for the symptoms of management. Lastly, the issue of collaboration is needed with emergency room team. Health education programs on pain management